I thought on my very first week of clinicals that their expectations are they're expecting you to come prepared, know your patient, especially that very first patient. Try to do as much digging as you can, even though it's going to be very overwhelming. You're going to be super slow with the medical record and looking through it. Try to look at your other patients and see anything that kind of stands out. And I think just coming ready to learn and eager and excited and being that personable person and, being able to read the room and mesh with that CRNA that you are with that day, I think those are the expectations. Obviously, know all your drugs. It depends what program you're in, but like for us, we're in a front-loaded program. We've covered a lot of our pharmacology classes already. At least I have, and I know now you're done with yours. Other programs are a little bit more integrated where they haven't. So it just depends where you're at in your program. But for me, I made sure that, hey, like, I came ready for business on whatever drugs I was planning on administering and making sure that whatever drugs my patient was taking at home, I had good knowledge based on them.
Hello, future CRNA. Welcome to CRNA School Prep Academy podcast. I have a very special episode lined up for you today, and it is part of our guest host series where I am bringing current SRNAs on the show for you as a guest host on the CSBA podcast. And my thought process behind doing this is I wanted you to hear from current students, a variety of current students who are at different stages of their CRNA journey, and really allow you to kind of step into their world and hear them talk about what it's like to be a current student dealing with things like difficult preceptors or different anesthesia topics, clinical topics, maybe even things like time management, stress management, things like that. I think these episodes are going to be gold, and I hope you enjoy as much as I always do hearing from current students. I know for a fact that the reason why CRNA School Prep Academy is where it is today, and the reason why I have learned so much is from diving all in, listening to current students along with CRNAs share a wealth of information and really kind of taking all of that information and kind of compiling it into kind of the system that we have created today. And I know that you're doing the same thing by tuning into the show week after week, developing your own method, your own strategy, and your own system for success. So I hope you enjoy these guest episodes. Let's go ahead and get into today's show.
In today's video, Monica and I are going to talk about tips for SRNAs that are about to enter their clinical training. Before we get to the episode, we do want to thank Jenny and the staff at CRNA School Prep Academy for giving us a platform to be able to share with you guys. Let's get into it.
Hey guys, welcome to A Couple Nurses and Code Blue and Bullshit. It's your girl Monica.
I'm Cordero.
So today we have a few topics that we want to share with you guys, especially now that I'm approaching about my, 5th month in clinicals, I believe.
Yep. And I'm approaching my first day in clinicals in about 3 days from now. So you call yourself a veteran these days?
No.
No?
I do not call myself a
you're
veteran.
you're 5 months deep. But...
I'm still a baby. Please help.
So in today's episode, I want to ask Monica about some things that I can do to prepare as an SRNA going into clinicals for the first time. As you guys know, we both come from front-loaded programs, so...
Semi-front-loaded programs.
Semi-front-loaded. So, we'll dive into today's topics. I have a couple of things I want to ask Monica about, but before we get too far into the episode, be sure to like, share, subscribe. Of course, leave any comments that you have and give us 5 stars on whatever platform you listen to this on. We really appreciate the support.
Show the love.
So the very first question I want to ask you is, what are the expectations from, your preceptors on the very first day or first week as you enter clinicals?
I think and I thought on my very first week of clinicals that their expectations are they're expecting you to come prepared, know your patient, especially that very first patient. Try to do as much digging as you can, even though it's going to be very overwhelming. You're going to be super slow with the medical record and looking through it. Try to look at your other patients and see anything that kind of stands out. And I think just coming ready to learn and eager and excited and being that personable person and, being able to read the room and mesh with that CRNA that you are with that day, I think those are the expectations. Obviously, know all your drugs. It depends what program you're in, but like for us, we're in a front-loaded program. We've covered a lot of our pharmacology classes already. At least I have, and I know now you're done with yours. Other programs are a little bit more integrated where they haven't. So it just depends where you're at in your program. But for me, I made sure that, hey, like, I came ready for business on whatever drugs I was planning on administering and making sure that whatever drugs my patient was taking at home, I had good knowledge based on them. So being prepared, knowing your patient, just be cool, be calm. They know you're nervous.
What about little things like like machine check? You know what I mean? Like,
Oh, machine check is huge. I mean,
are they going to expect you first day to walk in and just be able to perform a complete machine check?
I think so. That's,
Yeah.
that's something that, again, it depends on the program that you went into. But from my experience, we do have the luxury of having lab, and we have the luxury of having lab in our program. And so I put my hands on these machines. Now, the machine that I do have in clinicals is completely different than the one I had practice in. But that's all about, how you ask for help and things like that. Because on my very first day, that we had kind of like a tour of the facility, I had asked our preceptor, like, hey, how do you do a machine checkup on this? Like, we
Right.
didn't use this one before. So, because we practiced on a bellows machine in lab, and this one's all piston driven. So I was like, I reviewed my machine before, but I also had no idea how to do a machine checkup on this. I mean, you can do some YouTubing. Everything's on the internet nowadays, right? Like, if you're that eager, you can go ahead and do that. But it's okay to ask them, like, hey, how do I do a machine checkup on this?
I was wondering about that. I know we're going to listen back to this episode and be like, that was such a dumb question. But I remember learning about the piston-driven machines, and do they have that sound, that artificial sound of the bellows?
It's so annoying.
Like,
Yeah. And
and it's
it has
electronic.
like a breathing sound, so I like to turn mine off because it just
You don't like the
I don't
sound?
like it. It's too
They
loud.
say it gives some people comfort.
It doesn't give me comfort.
It's fake.
It makes me anxious. I'm like, just stop. As long as I see the
Mute.
patient stats are good, end title is good, and we move in there with the bag, like I'm good. But just to kind of like wrap up on that question, I think just be prepared. Be prepared. Somebody's going to ask you a question. Are you going to know the answer? You may, or you may not, and that's okay. I think having a positive mindset with being eager to be at clinicals and super excited, that's going to definitely show. And just being willing to put yourself in an uncomfortable situation, even in those first couple of weeks, it's going to show and it's going to shine through. Being prepared and, just kind of remind yourself, like, you're starting at the bottom of the barrel again. Like, we all were once that ICU nurse that, we felt real comfortable in our role as we were still, like, developing in as a bedside nurse, but this is completely different. So just have a little bit of grace and, yeah.
I like that. Okay, so the second question kind of goes online with the expectations. So, are they going to be expecting you to have care plans prepared? Do you prepare care plans for yourself? Yeah. What about care plans?
Care plans suck.
Yeah.
Let me just start off by saying that I see the value in them, but depending on how your care plan is structured and whatever program you're in, some of them are just doing the most.com. But again, it's just that part of that process that you have to go through. I personally do like doing sometimes a care plan because it allows me to, let me back up. Whether I'm following the structure of my school or not, like, I still like to do some form of a care plan and planning, whether that's in my head on a piece of notebook paper or whatever the case may be, because there's nothing better than coming into your room, the machine is checked off, you have everything drawn up already, you got, you have all your tools that you need for, that assignment, and CRNA walks in, you introduce yourself, you're like, hey, like, this is what I was thinking for this patient, and, and it sounds good. And they may not go with it, and that's fine, but at least you came with the plan and you were ready, you know your patient. So care plans, there is value in them. They are just extremely time consuming, especially around the time where I was in my program when I first started clinicals. It's like we had to do one every single day. It's still an expectation for us, so I still, will definitely do one, especially for new hard cases.
Yeah.
But it can be extremely helpful, and not relying on one source is key. Like, don't just go to Vargo, y'all. Like, we all want to do it. Don't just go to Vargo. Like, open up Garage, open up Nagelhout, whatever the case may be. Joffy's good. YouTube's good.
Well, about the care plan, so when you say sometimes you make these like mini care plans,
Yeah.
do you write those down, or is that kind of just something that's in your head?
It's in my
or-
head, and I think it just depends on how you can remember things and how your brain
Yeah,
functions.
I have to write things down. I probably end up writing. I have no cards or something.
Yeah, I mean, then that's fine. It's whatever works for you and whatever makes you comfortable. Because I mean, there's a very good chance that you're gonna forget.
Yeah.
But I don't know the way that my brain works sometimes. Like, I'll just be like, oh, okay, like they got this, I'm gonna do this, I'm gonna do this, and I'll have a couple options in my brain. You know what I mean? So okay, but overall, honestly, like, as much as the care plans suck, I do, like I said, I do find some value in them. Whether like you're doing your own or you're following whatever template that your school gave you. But be prepared because some preceptors are going to ask you for your care plan. They're going to want to physically see,
Yeah.
hey, here's a care plan. It depends on how your clinical coordinator on your school communicates with your clinical coordinator at your site. So just do your care plans, y'all. We signed up for this. We prayed for this moment. We are excited to be here. It is super time consuming. We have no life, but it's part of the game. So, at the end of the day, you put yourself in that situation. Just do things the right way.
And I also think I just feel like it should be a very intuitive thing that if you're starting out, like care plans seem like they would make sense. Like even once we get into our careers as CRNAs, like you need to have some kind of plan and some kind of backup plan.
Yeah.
You know what I mean? Like that's kind of I feel like the base and the foundation of like
Absolutely.
everything that we do. You know what I mean? Like of course like you put somebody to sleep, but like what is your plan?
What is your plan?
And what are you expecting to happen throughout the case? And
Well, if something bad happens, then, okay, like, hey, I planned for this. I know exactly what I got to do, right? You may not know how to mix that medication, but you know that that's what you want to grab for, right? So
you're not having to think.
right. So
Yeah.
you're halfway there already. So I think that it makes a huge difference from that. So I think that that's an excellent point, honestly. And like you said, like especially in the beginning of clinicals, like we don't know anything. The least that you can do is come prepared to clinicals and have a care plan ready to go. Again, it's time consuming because sometimes you don't know exactly where to find things, and that honestly just kind of comes with time, and then it's going to get a lot better. But I can tell you there's been so many times where I kind of like to make sure I'm there for that very first assessment if I'm not able to do my first initial assessment by myself. Just depends what kind of facility you're at. And listening to the anesthesiologist like do their assessment, and I'm like, okay, like I know what they're talking about. Like, yeah, like this was on their MAR, right? Or they'll ask them a specific question, and sometimes patients they can't remember everything. We've all been in healthcare. We know how patients can be sometimes, and it's just part of life. But when you know something that the physician doesn't know, because you're in this like team model, it feels so good that you were able to
Pick up on that.
help right and add kind of to like the sequence of events and just kind of like the plan and be able to formulate it together, and it feels good. You're like, oh yeah, like I knew that. Like they're like, oh, like how'd you know that? Where'd you find that? I'm like, oh, I found it here on this like extra medias or whatever in the
You be
chart.
digging.
Right. So if you do your digging, it's gonna show, and you're gonna be thanked for it, or you're not gonna be thanked for it, and it's just gonna be good that you look well prepared. You know what I mean? So
Right.
at the end of the day, it's depending on what model you're doing your clinicals at. It's a team dynamic, so everyone helps each other out.
That's awesome.
A daily dose of inspiration from a CRNA School Prep Academy student. I have been waiting to write this post for a few years now, 3 to be exact. I finally got accepted to CRNA school. Thank you so much to CSBA for everything. I have been a member for 3 years and went to 2 conferences, which was super helpful. I also did 2 mock interviews. I then did the 5-day interview boot camp 3 separate times as well. Here's my story. This has been a lifelong dream of mine since I was 13 years old. My GPA was a 3.2, so not the best, and I refused to take the GRE because I don't feel standardized tests should be used to determine the quality level of a student. I worked at a busy level 1 trauma center for 6 years and was a part of every committee possible. I also had my CCRN, my TNCC. I was charge nurse and a preceptor. I took grad level biochemistry course from Oregon State as well. I applied to over 7 different schools and only got 2 interviews. Rejection was not fun over and over again, and after a failed interview in January, I almost gave up. CSBA helped me so much and gave me the motivation to keep pursuing my dreams. Moral of the story, do not give up. I just love this story so very much, so dear future CRNA, you know who you are. Congratulations, I'm so incredibly proud of you. If you're not already subscribed to our free Future CRNA newsletter, be sure to do so now, pause this episode, and click the link in the show notes or comments below. Cheers to your future. Now back to the show.
And going into another question, when we're preparing for clinicals, what about pimping? You've heard about pimping. I think a lot of SRNAs are scared about getting pimped. Have you been pimped, and what kind of things have you been pimped on?
I've been pimped, and it's just like, sometimes it's like the most randomest drug fact that you barely covered in class, that was just kind of like at the end, the bottom of the nose, or like maybe something that you just completely forgot. I think for me, I can do well under pressure. I really believe I can, especially like in like traumas and stuff. But sometimes I think my struggle is having to understand, what are you asking me? So I'll miss the question because I'm like, I have no idea. You're being trivial with me. Just ask me.
I knew that.
Oh, I knew that. Why'd you make it so difficult? You know what I mean? So I I don't know. I think I've been pimped on what's in Oframev, like what other ingredients in Oframev, and it's like it's mannitol, and they wanted to know exactly how much. And I was like, all right, cool. Another question was just, you got a patient that has an allergy to pork or something like that. So they're like, you're in cath lab with medication you got to think about not giving, heparin. And then I get some weird, real trivial questions, So, but again, you do your care plan, you know what you're talking about. You know what I mean? Especially in rooms like, thoracotomies and one lung ventilation, and just really understanding like the physiology and the anatomy, especially when you're putting down the fiber optic tube, things like that, like being able to read like your ventilator numbers and knowing how to, intervene if your patient starts desatting, like all those things are very important. If you're gonna do your care plan, I mean, if you smart and you got it down, send me those vibes, you know what I mean? But like prepping for a case, like just do it. Like it makes you look better, it makes you look more prepared.
Yeah.
So these are patients' lives. Like it's like why would you go into something so unprepared? That it's just not gonna make you look better, and you're not gonna be able to evolve as a student. You're not gonna make yourself any better. So
I mean, quite frankly, it sounds kind of lazy, like it does. But as you said, some people just have this photographic memory that they can just like think on the fly,
right.
And like that's just how some people work.
That's great. I'm jealous. I love that for you.
Okay, and then the last thing I kind of want to ask on the first day is like, what are some supplies and like stuff that you should get for the first day? I know you kind of did a video in the past about your little Lululemon bag and
the Dupe Lululemon. We
what would you recommend people get prior to their first day of clinicals and SRNA?
So I remember I did my little Dupe Lululemon bag, and some people would disagree on having a train of 4 monitor on you because most rooms will have one. But I'm telling you, like I emergently intubated in PACU one time, pulled out my little handy dandy.
Like 1 second.
1 second, I got y'all. Let's check for some pseudocholinesterase deficiency, and it was very useful. So that's what I've had in mind. Definitely a pen. I definitely like having like a little Sharpie on my badge buddy like holder. I think that's super important. Pen super important too. I definitely like having my little stethoscope holder because there's nothing more uncomfortable than putting that around your neck, especially all day, and then it's swinging in somebody's face while you're trying to intubate. Like, just don't look good. And lotion. Definitely pack a little lotion and some chapstick because them lips gonna get dry.
I saw you got some new shoes too. Dude, she bought 3 pair of shoes for clinicals.
No.
You have 3 pair of shoes.
And I only used 2. I got some New Balances, some On Clouds, and some Adidas. Okay, yeah, I have 3 pairs of shoes because I was just trying to find like the perfect shoe, and I think I found them. I like the On Clouds a lot. I think I need to try a different model because now my little shins are starting to hurt. And then I tried the New Balances. They're super comfortable, but they're too fluffy for me, and I feel like I'm gonna break my ankle in them. And then Hoka's are just, I'm sorry, they're ugly. Like,
yeah, they are ugly. She was
tomatoes.
For the longest time trying to tell me about these Hokas, and I was trying to tell her how ugly they were.
Well, and then luckily I went and tried them on, and they hurt my feet. So out of the equation, hyped. Sorry for those that love the Hokas, not for me. Anyways, I think having all that ready. Ooh. Okay, what's really good, guys, okay, if you don't have, I've talked about this before in some of our other videos, if you do not have the Notability app, please grab that, because I have...
For clinicals?
Yes, okay, if you have a Notion, there's a Notion app, obviously, and I do Notions for all of my class. There's been so many times where I popped up my Notion app and I just searched something that I had forgot about some drug, and boom, right there.
So Notion, not Notability.
Both. And even with Notability, that's where I have all my class notes that I've ever taken or that have ever been distributed to us. And I also have a certain folder where I have my care plans on. So anytime I forget something, I'm just gonna open it up in my, in my phone and be like, boom, it's right there. So definitely download the Notability, transfer all of your notes from all your classes, have them all organized, because it has the search option. So if I just put, I don't know, X, and, I forgot my dosing or something like that. It's your first day, and you're like, oh crap, like, what do I give, right? Boom, right there. Like, and it's so easy. Definitely the Vargo app is super useful. I definitely love the Vargo app, especially for like if I prep for all these cases, right? And like, let's say one of them gets canceled and I have no idea what we're doing for this other one. I do a quick little search and, you know, it's kind of saves you for the day. So those are just some tips that I would recommend for the first day of clinicals. I mean, just for clinicals in general, to be honest.
Okay, so that's kind of the topics I want to hit. If there's anything else that you want to add for first day clinicals, then
I mean, like, honestly, you're going to be so nervous. I just
nervous.
remember
I'm
being
so nervous. I can't even lie.
I remember being just like in the parking lot and I was just like,
Oh, yeah.
here goes nothing, right? And it's just like, I was paired with the chief, and so those nerves got extremely heightened as soon as I found out that he was the chief. Like, if nobody would have told me he was the chief, I'd been like, all right, straight, like let's do this thing, right? And so I'm like, oh man. And you know, it's supposed to be like a just one observation day, and we just go straight to intubating, straight to like learning, and I was just like, you know, the nerves were still there. They were kind of just like decreased a little bit, and it just was like, wow, like, I don't want to say like this is my calling, but it was just like, it was one of those feelings where just like, I feel like I'm where I'm supposed to be right now. And it's such a like of a bittersweet moment because you have all this anxiety, you're so tired, you're still sleep deprived, and you're trying to like keep up with classes if you're taking classes still. But then in that moment, I just remember going to the bathroom and I was like, holy crap. I was like, I absolutely love this. Like, this is so much fun. And I think going into the rest of your clinical days, you are going to be miserably tired. And, you know, changing up your mindset and just kind of training your mindset and just telling yourself, like, you know, it's this is the only time that you're going to be getting your hand held on making such important decisions intraoperatively, preoperatively, postoperatively. So think of it like that. Like, when you graduate, yeah, you're gonna be on your own. You out of there. Like, yeah, you have, you know, your people to kind of rely on, but like, this is the one time where, you know, you're able to bounce those ideas off of somebody else that's been doing this for a lot longer, and it's just all about mindset. Stay positive, stay driven, ask questions, be personable, don't be a know-it-all, don't be rude, read the room, be nice to your techs, be nice to your OR circulators, be nice to everyone, and never know when somebody's watching. So just do your thing. Don't kill it out there. This, you know, if you're prepping for clinicals for the very first time, or you're thinking about going to CRNA school, like, this journey is so long, and it was just like I said, after that first day, I was like, and even still now today, like, I'm so tired. I'm studying for a test right now.
Are you still nervous?
I am nervous sometimes. You know, when I go into like new procedures, like I remember when I went into my first cab, I was like, oh man.
Yeah.
You know, you're always going to be nervous. And I think being nervous is such a good and important feeling to recognize for yourself, because it means that you care, right? It means that you care and you want to be as good and as prepared as, you know, as you can be. So I think, you know, it's all part of the process. And
it's good words. I think you gave some people some encouragement out there. I would definitely feel inspired and ready, because I feel like I do possess some of those. You know, if nothing else, I can show up enthusiastic and open to learning.
Yeah.
And I can prepare the best that I can.
Yeah.
You know, I feel like just doing those things is kind of sets you up, you know, so it's good to hear that.
Yeah, you're going to be great. You're going to kill it. All those that are tuning in, it's your first day of clinicals coming up soon. You got it. Because I just come prepared and just be you, like, be personable. So.
Yeah. Okay. All right, guys. Thanks for tuning in to the episode. And we'll talk to you next time.
Bye, guys.
Peace.
Hey, future CRNA, as always, I appreciate you and your loyalty. Thank you so very much for tuning in this week. I'd love to hear from you, so screenshot this episode and share it to your IG stories with your biggest takeaway. Don't forget to tag me at CRNA School Prep Academy so I can personally thank you. Be sure to head over to CRNASchoolPrepAcademy.com to check out our blog and gather free resources to help you along your CRNA journey. Stay strong, and I'll see you next week.